Hi, my name is Rohini Patel, and I am a general surgery resident at UC San Diego under the mentorship of Dr. Mahmoud Malas. Our manuscript is focused on patients who are undergoing a peripheral vascular intervention, and if a greater emphasis should be placed on smoking cessation for patients undergoing non-urgent procedures. We used the VQI Vision Medicare Link database over the course of 15 years and performed a propensity score matched analysis on 3,000 pairs of patients. We found that when comparing current smokers to former smokers, the current smokers have lower overall survival and amputation-free survival at 5 years. Interestingly, when comparing former and never smokers, there were no differences in 5-year outcomes for survival, amputation-free survival, or reintervention. Overall, we found that in the Vision database, current smokers have worse outcomes than former smokers, and former smokers gain the advantages of never smokers. Therefore, claudicants who are actively smoking should be encouraged to stop smoking prior to any endovascular intervention. Thank you.